Dr. Vijay Bhaskar, Chairman, Ethics Committee, Clinical Research and Trials, Masters in Orthopedics. Today we are going to discuss about the knee pains. Knee pain is one of the most common pain in our human body because it is more mobile and more weight bearing part of our body. Knee is such a hinge joint. It acts like this. This is called a hinge joint. It has a femur, it has a tibia, it has a patella bone. These three bones together form a knee joint. So, in and around the knee joint, we see a important part of the knee joint is cartilage. Otherwise, we call it as a menisci. So, these are menisci which are rubbery in nature, or a smooth rubbery in nature, which act like a shock absorber for the joint. Whenever we jump, walk, the injury to both the bones will be suppressed or protected by these menisci or the cartilage or a disc called. So, these two discs are most important for the joint, and ACL, anterior cruciate ligament, and posterior cruciate ligament, these two will not allow the joint to go more than forward or more than backward. So, these are the two, ACL and PCL will help you to protect moving more anterior, more posterior, or within the range of movement it will contain the joint. These are the collateral ligaments, which ligaments are more protecting the joint to move more than normal laterally or medially or outwards or inwards. And this is the most important quadriceps muscle, tendon and the bone. The power of this quadriceps tendon is more than a truck weight pulling out. So, why the knee joint pain persists more is there are lot of reasons. One could be a injury to the joint, a trivial injury to the joint, a injury to the ligaments, a injury to the menisci and the collateral ligaments, even the patella tendon as well as the ligament of patella. The next is there is a chances of infection in the joint, whether it is a tuberculosis or a septic arthritis. There is a immunological disorder lead to certain chronic arthritis, that is rheumatoid arthritis, very rare gouty arthritis and non-specific rheumatoid arthritis, viral arthritis, vagaira. The most common we see after 40 age is a degenerative osteoarthritis. That means the menisci, the cartilage both together, which are protecting the movement of both the bones, and most of the cartilage is weight bearing. Our 80% of our weight, individual weight, bears on this cartilage, which wear and tear leads to degeneration. So, till the age of 45-50, it will have a normal congruity. Otherwise, if there is a fracture or injury to the cartilage, after the age of 50, the natural degeneration of this cartilage leads to osteoarthritis. Means when this cartilage is degenerated, the bones touch each other, will leads to wear and tear necrosis, and then the bone ends will be necrosed, degenerated and deformed. So, knee pain always leads to certain problems like this, which we need to protect. So, how do we rule out the pathological injuries or pathological degeneration? When there is a vitamin D, calcium, minerals deficiency, that leads to the bone natural and more natural damage to the bone ends, leads to microfractures, leads to degeneration. In our Indian families, most of the persons will have vitamin D and vitamin calcium and minerals deficiency due to lack of nutrition, lack of sunrise exposure. In that cases, we must take care, rule out calcium levels should be more than 9, vitamin D levels more than 30, and balanced B complex and minerals. When there is a deficiency of vitamin D, calcium, minerals and B complex, there will be a natural degeneration of the bone. So likewise, when there is a damage going on increasing to the bone ends, leads to the degeneration, deformity. So this all we can rule out within a basic X-rays, certain blood tests, whether it's a immunological disorder, whether it's a infectious disorder, whether it's a injury disorder, whether it's a any other than pathological injuries or tumors. So after ruling out all the disorders, then we should come to a conclusion with basic X-rays, CT scan, MRI and as well as certain blood tests according to the diagnosis. Once we come out to the diagnosis, we must take care of certain pertaining to that diagnosis. So this is what all I want to say, dear friends. The knee pain has multifactorial cause which we have to rule out and treat the disease.